Let me start with a story that might feel very familiar to you. A few weeks ago, a 72-year-old patient said something to me that I'll never forget. He told me, "I don't mind getting older. I just wish my knees didn't remind me every single morning." He described how he wakes up before sunrise, swings his legs over the bed, places his feet on the floor, and then just sits there, waiting for his knees to turn on, waiting for the stiffness to ease, waiting for that sharp, rusty ache to calm down enough so he can stand without bracing himself on the nightstand. And I asked him a simple question. Do you remember the last time you stood up in the morning without thinking about your knees? No wincing, no bargaining, no slow countdown before you rise. For many of you over 60, that simple act has quietly turned into a daily negotiation with your own body. You wake up feeling fine, but the moment your feet touch the floor, your knees feel like they belong to someone 20 years older. They're stiff, they're tight. Sometimes they creak like an old wooden door that hasn't been opened in years. And here's what concerns me the most. So many people accept this as just aging. They say, "Well, I'm not 40 anymore. This is normal at my age. I guess this is how it's going to be." But I need you to hear this clearly. Morning knee stiffness is common, but it is not inevitable, and it is not a life sentence. It is a signal. Your knees are not betraying you. They are communicating with you. They're saying, "We need attention. We need circulation. We need activation." And the best time to give them that attention is the very moment you wake up. Today, I'm going to walk you through 5 gentle, safe, and incredibly effective exercises you can do every single morning. You don't need equipment. You don't need to get on the floor. In fact, the first 2 start right there in your bed before your feet even touch the ground. We're going to count down from exercise number 5 to number 1, and I saved the most powerful one for last. It targets a muscle almost everyone ignores, the very muscle that determines whether your knees feel stable and supported or unstable and painful. And stay with me until the end, because I'm also going to share a 60-second morning joint habit that works like oil on a rusty hinge. It's simple, it's free, and it starts helping from day 1. Let's begin. Exercise number 5, the bed heel slide. We're starting gentle. We're starting smart. You've been lying still for 7 or 8 hours. During sleep, your joints are not moving. The synovial fluid, that's the natural lubricant inside your knees, becomes thicker overnight. Think about honey in the refrigerator. When it's cold, it becomes sluggish and dense. That's essentially what happens inside your knee joint while you sleep. If you immediately stand up and load your full body weight onto a stiff joint, it's no surprise those first steps feel painful. So we warm it up first. Stay lying on your back. Keep one leg straight. With the other leg, slowly bend your knee by sliding your heel along the mattress toward your body. Go slowly. Feel the motion. You should feel a stretch, but not pain. Then slowly slide the heel back down until the leg is straight again. The mattress supports your leg, which means there's almost zero pressure on the knee joint. You're simply restoring motion and gently pumping that synovial fluid so it becomes thinner, warmer, and more slippery. Let's walk through it together. Right heel slides toward you, smooth, controlled. Stop where it feels comfortable. Now slowly slide it back. Now the left heel. Slide it in and back out. Do not force the range. If your knee only bends halfway today, that's okay. Every morning will feel slightly different. The goal isn't depth, it's motion. 10 repetitions per leg, about 2 minutes total. By the time you finish, your knees already feel different, looser, warmer, less resistant, and you haven't even stood up yet. Now we move to exercise number 4, the lying quad set. This one is critical. The quadriceps, the large muscle on the front of your thigh, is your knee's natural shock absorber. When it's active, it protects the joint. When it's weak or asleep, your knee absorbs far more stress. And after a full night in bed, Your quadriceps is essentially switched off. If you stand up with a sleeping quad, the joint pays the price. That's why those first steps hurt the most. Here's how we wake it up safely. Stay lying on your back with both legs straight. Now, press the back of one knee down into the mattress. You should feel the muscle on the front of your thigh tighten and firm up. Place your hand there. You'll feel it contract. Hold for 5 seconds. 1, 2, 3, 4, 5. Then completely relax. That's 1 repetition. You are activating the muscle without bending the joint. This is called an isometric contraction. It's one of the safest strengthening techniques. Even if you have arthritis or a history of knee replacement, do 10 repetitions per leg. And breathe. Don't hold your breath. Inhale, then gently squeeze as you exhale. By now, your joint fluid is moving and your quadriceps is awake. Now you can sit up. Exercise number 3. Seated knee extensions. Sit on the edge of your bed or a sturdy chair. Feet flat on the floor. Sit tall. Slowly straighten your right leg out in front of you. Lift until the knee is comfortably straight. Point your toes toward the ceiling. At the top, squeeze the front of your thigh firmly for 1 extra second. That extra squeeze matters. It activates the portion of the quadriceps that weakens fastest with age, the part most responsible for knee stability. Hold for 3 seconds, then lower slowly. Don't let gravity drop it. Lowering with control builds strength faster than lifting alone. 10 repetitions per leg. This mimics real-life function: walking, climbing stairs, rising from chairs. If one knee is stiffer, start with the better side first. That warms up your nervous system and prepares the other side. Now we stand. Exercise number 2, standing knee circles. Stand near a wall or hold the back of a chair. Feet together. Bend knees slightly, just a few inches. Place hands gently on your kneecaps and begin making small, slow circles. To the right, forward, left, back. Small circles. Gentle, smooth. This lubricates the joint in multiple directions, something straight-line movements cannot fully accomplish. Do 10 circles clockwise, then 10 counterclockwise. If you feel a click or tight spot, slow down there. That's the area asking for attention. Work gently through it. If rotational movements aren't appropriate for you due to prior meniscus injury, simply double your seated knee extensions instead. Now we arrive at exercise number 1. This is the one that changes everything. Wall-supported mini squats with isometric hold. This targets a small but powerful muscle called the VMO, located on the inner side of your knee just above the kneecap. It's the muscle that keeps your kneecap tracking properly. When it weakens, the kneecap drifts slightly out of alignment. That misalignment creates grinding, inflammation, and pain. Stand with your back against a wall, feet about 1 foot forward, shoulder width apart. Slowly slide down the wall, but only slightly. Stop at about 30 degrees of bend, very shallow. Why shallow? Because the VMO is most active in the first 30 degrees. Go deeper and larger muscles take over. Hold here for 10 seconds. Press your back gently into the wall. Squeeze your thighs, especially the inner area above the knee. You may feel shaking. That's normal. That muscle hasn't been fully engaged in years for many people. Hold. Then slowly rise. Repeat 5 times. Within weeks, this alone can dramatically improve kneecap tracking and reduce pain. Now, the promised 60-second joint protocol. After finishing the exercises, drink 1 full glass of room temperature water. Overnight, your body becomes mildly dehydrated. Synovial fluid thickens further when hydration is low. Cartilage does not have direct blood supply. It relies entirely on joint fluid for nutrition. Movement spreads the fluid. Hydration replenishes it. While drinking the water, perform 10 slow ankle circles per foot. This keeps circulation active as hydration begins to absorb. That's it. Let me summarize your morning. In bed, heel slides. In bed, quad sets. Sitting, knee extensions. Standing, knee circles. Wall mini squats. Then water and ankle circles. 8 to 10 minutes total. And here's what I've seen time and time again. Within 7 to 14 days, people who once dreaded mornings begin standing with confidence again. They stop bracing the nightstand. They stop pausing before walking. They begin taking stairs instead of elevators. They get back down on the floor with grandchildren, and more importantly, they get back up. Your knees are not broken. They are underactivated, undercirculated, underhydrated. Aging is inevitable. Decline is not. So here's my challenge to you. Try this routine for 7 mornings in a row. Just 7. Don't skip, don't rush, commit to it. And pay attention to how you feel on day 3, and day 5, and day 7. Your body responds to consistency. Tomorrow morning, instead of negotiating with your knees, you're going to lead them. And when your knees feel supported, stable, and strong, your whole day changes. Take care of your knees, and they will carry you farther than you think. I'll see you in the next session.